COVID-19 fatigue is real. It isn't a diagnosis, but rather a description for a range of symptoms and frustrations with the prolonged pandemic response. The longer this pandemic goes on, the bigger the impact COVID-19 fatigue has on our mental health. It is important to know that you are not alone in feeling the way you do. In fact, all of us will likely experience increased feelings of social isolation and loneliness. While this is true at any time of the year, I think those feelings will be even stronger during our holiday season. Traditionally, this is a time we connect with family and friends, and while we still need to do that, we must do it differently this year. While the holidays can bring out the best in people, they're also a time where feelings of social isolation and loneliness can feel even more acute. And many of the people at the highest risk from COVID-19, the people who should be most vigilant about social distancing, are also the most at risk for feelings of increased social isolation and loneliness. I urge all New Brunswickers to take care of your emotional health today and in the days to come. Pay attention to how you are feeling and take the necessary steps to manage the stressors in your life. Exercise regularly, eat healthy meals, get plenty of sleep, and avoid alcohol and other drugs. Maintain a regular routine and make time to unwind and manage your emotions. Develop a plan to remain connected with others without exposing each other to COVID-19. Where possible, use technology to stay connected with friends and family and share your concerns with others. Sometimes, simply talking about what is bothering you can help alleviate the stress and anxiety associated with it. Give yourself a COVID-19 break. While it is important to stay informed, it is easy to get overwhelmed with all of the information out there. Look ahead at your calendar and identify social connections that might be disrupted during the outbreak and consider alternative solutions to stay connected. Create a list of community organizations that can provide support and resources if needed. And as Dr. Russell said, 211 can be a close resource for you. If you are struggling to cope, please reach out for help. Doing so is not a sign of weakness. It is a sign of strength. Resources are available, including Kids Help Phone, Chemo Helpline, and Hope for Wellness Helpline. If you have a pre-existing mental health condition and are experiencing new symptoms, or you feel you are unable to cope with your normal responsibilities, please contact your healthcare provider or a local addictions and mental health center. More information on these and other resources can be found on the coronavirus page of the Government of New Brunswick website. And if someone reaches out to you, please listen and help where you can. We are truly all in this together. And that is how we will get through this challenging time, through kindness, empathy, and support for one another. Right now, things are especially hard as we experience the second wave of the pandemic. What is happening now is the result of actions taken in the past week or two. We can't change that, but we can make a difference in going forward. If we all follow public health measures and take the steps needed to keep one another healthy and safe, we will see better results in the next week or two. Working together, we have the power to make a positive difference. Thank you. Merci.